My name is Katie Smith, and welcome to Seniors Today, a monthly program for those 50 plus in Montgomery County, produced by the Commission on Aging, of which I'm a community member. Today, we'll learn more about the impact COVID-19 is having on the senior population and hear updates from our local health experts about where we stand locally in the midst of this pandemic and the county's robust public health efforts. Joining me is Dr. James Bridgers. Dr. Bridgers is the Montgomery County Deputy Health Officer. Welcome, Dr. Bridgers.
Good afternoon, Ms. Smith. How are you today?
I'm doing well, and yourself?
Very well. Thank you for inviting me to your senior show today. Always glad to talk about public health in the interest of our seasoned seniors. And it's April Fool's, so I'm going to leave you with this no joke. No fooling, I should say.
Well, let's jump right in. Can you provide us with a coronavirus update about the latest numbers of cases in the county and the projections as far as when a surge may occur in the county?
So great question, Ms. Smith. So the data is indicating that on today, April the 1st, we've seen this past year 66,831 cases with unfortunately 1,430 deaths. And as of today, we had 129 cases. And so we continue to monitor the number of cases on a daily basis, on a monthly basis, and on a weekly basis to identify those areas of needs in which we need to prioritize. So looking at those cases and how we respond to the COVID pandemic, I should say, and opening, we look at all these indicators to determine if in fact we need to roll back some of the provisions or being able to increase some of the provisions. And for the last 2 to 3 weeks, we've seen a slight uptick in the test positivity rate. Now, the test positivity rate for today, April 1st, was 3.22. And what that means is that about 3.2% of the cases of the tests that we have to date test positive. So that tells us that 2 weeks ago, it was 1.92. And that means that the transmission is increasing in the community. So we still need to be mindful and vigilant that the virus is still spreading. It's spreading at a rate where we need to monitor. A moderate to low transmission rate, according to the World Health Organization and the Centers for Disease and Prevention and Control, is about 5%. And if we're talking around 3%, it's a moderate to low rate. And as we see those indicators go up, we need to take a step back and assess where we are with our resolutions, our provisions, our opening, and our closing to make an assessment to see if something needs to be rolled back.
Wow, that's interesting. Thank you so much for providing us, with a sense of the landscape right now, especially from your expertise. And you're one of our trusted healthcare officials. Dr. Bridgers, County Executive Mark Elridge, he recently announced that Montgomery County will be hosting a mass vaccination site. Can you share a little bit more about it in terms of the timing and location?
Sure, great, Ms. Smith. Yet another great question. And Dr. Gales and I just visited the mass vax site this morning. It's located on the Montgomery County campus in Germantown. And we're able to vaccinate 2,000 to 3,000 countyans a day with the goal to vaccinate 21,000 folks a week. This vax site, this mass vax site, is in partnership with the state of Maryland, the Montgomery College, the Montgomery County Police Department, our Emergency Management and Homeland Security, and Holy Cross. So it's a partnership to provide a higher throughput and capability to vaccinate in an area where we've seen higher case counts. And so we've looked at an equity index to identify vaccination spaces in the county. And the Montgomery County Mass Vax site is one of those locations where we identify as a platform where we could get more shots in folks' arms. Now, the Mass Vax site will be fully functional, we anticipate, on April the 8th. we are actually vaccinating at that space. Now it began yesterday, and we're vaccinating the current plan is to operate 6 days a week between 9 a.m. to 3:45 p.m. with the goal as we increase and receive doses from the state will provide the amount, the increase in doses for this particular vaccination site. 7 days a week to accommodate those individuals, those seniors and individuals who are still in the workforce and may not be able to attend or get vaccinated once they receive the registration link, either from us or the state. Again, it's a partnership with the state to provide more shots in arms in the county. And so through this vehicle, we anticipate that we will be able to operate 7 days a week, including the weekend, from 9 to 7 o'clock to accommodate those individuals who are unable, for whatever personal or professional reasons, to get vaccinated at one of our previous sites during those specified timeframes.
Wow, that's great. I know you mentioned, you have an equity component, and with so many people of different backgrounds living in Montgomery County, I know that they'll appreciate that. In the little bit of time that we have left, I want to ask you just a two-part question. The first
Sure.
is, you told Montgomery County Council, some of those members at a briefing, that your own father tested positive for COVID. So what about testing? I want to know if that's still a part of your improvement strategy, and how to mitigate the virus impact in the county. And then briefly tell us, as we wrap, how can people stay in touch with you as well as our local health department?
Sure, Ms. Smith. Yet a third great question, although the last question part is two parts. So let me answer the first part. So yes, my father did test positive, and more recently, my sister tested positive, and she's 50 years old, and she tested positive earlier this month. All that to say is that there are variant strands in the community. We have the B.1.1.7, which is the UK. We have the B.1.351, which is the South African. We have the P.1, which is the Brazilian. And then we've recently been informed that we have variant strands from California and New York. All that to say is that if you feel sick, if you've been around folks who may have been exposed and you're unsure, please get tested. We have testing available. We have testing available 7 days a week in collaboration with our Minority Health Initiative, who've been very instrumental in supporting our testing effort. Testing has dropped, and we don't know whether or not it's due to COVID fatigue or folks are more focused on getting vaccinated, but we still need you to get tested if you are in the community significantly or you've been around folks. And so we still ask and encourage you to get testing. We are pushing more for testing to mitigate the risk and suppress any community transmission. The first question was, about testing and where we are with the cases and the test positivity rate. One of the measures or the approaches to decreasing the community transmission is to test folks, to get folks tested, to know their status, and to have them isolate for 2 weeks or until they feel better based on the CDC guidelines. What can we do? We still need to be vigilant. Dr. Walensky indicated on Monday that we still have a ways to go. So we still need to do those, employ those public health measures. We need to wash our hands for 20 seconds. We need to minimize our physical and social distancing. We know that folks are getting vaccinated, but only 30% of the population in Montgomery County has been vaccinated. And as we get more folks vaccinated, folks become more comfortable, we can interact, we can have folks in our personal space, and we still should take those safeguards and those measures in place. Wear a mask. If you are in public and you are in crowded spaces, you should wear a double mask. A cloth mask and a surgical mask is preferred based on the CDC guidelines. Make sure that it's tight fitting so that no air comes in or goes out. And we still need to be mindful of crowds. We still need to be vigilant and standing in those open air spaces where we have better ventilation. We want to see each other. We're social creatures. We want to interact. If you're living in independent living spaces or those spaces where there are more folks, it's okay to wear a mask or encourage others to wear a mask as we continue to test more and vaccinate more. There is light on the end of the tunnel. So all public health officials, from Dr. Fauci to Dr. Gales to myself, are encouraging folks to remain vigilant, to be guarded, to remain safe. And then one day, after all this is over, we can reflect on all those safeguards and those public health measures that we put in place to protect ourselves, and not only ourselves, but our loved ones.
I like it. Vigilance, guidance, and being safe. Well, Dr. Bridgers, what a wonderful conversation we've had. And thank you so much for your service and commitment to our seniors and our families and for keeping us safe. We appreciate you sharing updates on such a relevant topic and look forward to having you back. It's a pleasure to talk with you.
Thank you, Ms. Smith, for having me. Please, by all means, stay safe. And folks, if you haven't pre-registered, please pre-register at the county's COVID information portal. We have information about testing. We have information about vaccinations, those sites. Pre-register, again, going back to the mass vac site, the state will have a registration list for those who have pre-registered for Montgomery County, as well as Montgomery County will have a pre-registered list. So please pre-register, so that you can get vaccinated and again, protect yourself and your loved ones.
We'll make sure to provide that link. Thank you so much.
Thank you so much, Ms. Smith. Have a great afternoon and all stay safe and be well.
Thank you to everyone who was able to tune in and for those who will rewatch the program at another time. To learn more about services for seniors in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000.